If we then look at the deep layer, we can see we've got some muscles which are lying deep to flexor digitorum superficialis. We have flexor digitorum profundus. We can see that this is coming from the ulna. It's also coming from the interosseous membrane that's between the two bones of the forearm, the radius and the ulna. And this again gives rise to 4 long tendons that this time go towards the distal phalanx of each digit 2 to 5, not including the thumb. The thumb is different because it has its own specific flexor, and this is known as flexor pollicis longus, pollicis meaning the thumb. Flexor pollicis longus. The fact that we call it flexor pollicis longus indicates there's going to be a flexor pollicis brevis, and this muscle is within the hand, so we'll look at it later. The final muscle, the deep muscle in the anterior compartment, is pronator quadratus, and that runs between the 2 distal ends of the radius and the ulna. So let's have a look at the attachments of these muscles. Flexor digitorum profundus is running from the proximal surfaces of the medial and anterior surfaces of ulna and the interosseous membrane. So it's coming from the ulna. It then passes via its 4 long tendons to the distal phalanges, the medial 4 distal phalanges of digits 2, 3, 4, and 5. The nerve supply, it has a dual nerve supply. The lateral muscle bellies, these are the ones that are going to digits 2 and 3, are supplied by the median nerve, and the tendons that are going to digits 4 and 5 are supplied by the ulnar nerve. So flexor digitorum profundus has 2 nerves supplying it, the median nerve and the ulnar nerve. Its function is to flex the hand at the wrist joint, and it also flexes the distal interphalangeal joint. So where flexor digitorum superficialis flexed the proximal interphalangeal joint, this now flexes the very distal interphalangeal joint, the joint between the distal phalanx and the middle phalanx. If we go back and look at flexor pollicis longus, we can see this is really coming from the radius, and this gives a long tendon that goes and attaches to the distal phalanx of the thumb. So we can see that flexor pollicis longus, running from the anterior surface of the radius and also the interosseous membrane, passes to the distal phalanx of the first digit being your thumb. The pronator quadratus, as we saw here, is running between the 2 distal ends of the radius and the ulna. It runs from the distal quarter of the ulna, so the last quarter of the ulna, and it actually passes towards the radius. So when pronator quadratus contracts, it is actually going to move the radius. It is going to move the radius into a more pronated position. So from this supine position, contraction of pronator quadratus is going to pronate the radius, pronate the forearm, which pulls the radius over the ulnar bone. Both flexor pollicis longus and pronator quadratus are innervated by the anterior interosseous nerve. And this is a branch of the median nerve. So the median nerve is supplying the majority of these muscles within the anterior compartment, but a specific branch, the anterior interosseous nerve, is supplying the flexor pollicis longus and pronator quadratus. Flexor pollicis longus does similar functions to flexor digitorum muscles, except it acts at the first digit. Continued contraction will flex the wrist. It flexes the interphalangeal and metacarpophalangeal joints associated with the first digit. Pronator quadratus pronates the forearm, so it acts on the radio-ulnar joints.